Usually people notice that their breathing is heavy when they breathe more than 25 liters per minute at rest, or about 4 times more than the physiological norm. It happens mostly during the stressful situation as an acute change of breathing. When we don't handle stress correctly, then it can become chronic, and the problems with breathing can badly influence our well-being. Many people today suffer from breathing problems, and I'm going to tell you about 3 most common problems. All 3 problems cause reducing oxygen levels in body cells and can promote chronic diseases. By the way, if you want to have the pocket breathing exercises always with you, download them from the first link in the description. The first common breathing problem is chest breathing. Chest breathing or thoracic breathing is very common in modern people. Do you have neck pain, stiffness in trapezius, or do you suffer from shoulder pain? Let me know in the comments. It can be connected with dysfunctional breathing. More than 50% of adults have predominantly chest breathing at rest. What are the causes of this shift to chest breathing in modern people? It can be caused by sedentary jobs or chronic stress, or from a biochemical point of view, chest breathing appears when body oxygen and CO2 levels become too low. Chest breathing is even more common for people with chronic diseases who breathe too deeply at rest. During the stressful situations, our biomechanics of breathing is changing. We breathe more to the chest and upper chest area and less to the diaphragm. It is easy to observe this phenomenon. Medical textbooks, various Eastern therapies and techniques such as yoga, Buddhism, Tai Chi all teach that normal healthy breathing at rest is mainly diaphragmatic. At the beginning of the 20th century, breathing was commonly done with the diaphragm. Chest breathing can cause problems to our body in the long term. If we don't notice a change in the direction of our breathing, the acute stress could last longer than it usually should, thus causing great issues in our body. That's why we should be able to notice it and change the direction of the chest breathing to the diaphragm. Do you breathe with your mouth while resting? The second common breathing problem is mouth breathing during the rest. When you stop nose breathing and your mouth is open, you suffer from deficiencies in oxygen, carbon dioxide and nitric oxide in body cells due to hyperventilation. Each mouth breather needs to know this short summary of immediate negative biochemical effects of mouth breathing, which leads to decreased oxygen supply of all vital organs, overexcited state of nerve cells causing increased anxiety, so more problems with sleep, constrictions of airways, nasal congestion and frequent infections, muscular tension and tissue hypoxia, generation of free radicals in body cells, increased inflammation and heart rate, and abnormalities related to regulation of the blood pressure and blood glucose levels. So, if you breathe through your mouth, you should definitely change the way of your breathing during the rest. Change the mouth breathing to nose breathing during your daily routine. Our nasal passages are created to humidify, clean and warm the incoming flow of air due to the layers of protective mucus. This thin layer of mucus can trap about 98 to 99% of bacteria, viruses, dust particles and other airborne objects. The third common breathing problem is chronic hyperventilation or overbreathing, when a minute ventilation is increased for a long term even during the rest. Regardless of the superficial causes and triggers, there is one cause of mouth breathing: chronic hyperventilation. Chronic hyperventilation is a physiological state characterized by chronic overbreathing or breathing more air than the medical norm amount. Chronic hyperventilation syndrome in the sick is a common clinical finding, which is supported by the fact that many chronic diseases are developed from cell hypoxia. Many chronic diseases including heart disease, diabetes, asthma, COPD, cancer, sleep apnea, obesity, hyperventilation syndrome, panic disorder are possibly only in people with hyperventilation syndrome in the lungs. There are cultural or social reasons related to the modern perception of breathing. Since most people believe in various breathing myths, especially the deep breathing myth, they naturally assume that, for example, during time of stress, breathing heavily or deep breathing provides them with more oxygen, as oxygen is very important for health and well-being. The truth is that deep and heavy breathing during the stress is not helpful at all. Hyperventilation leads to the primary effects outlined above. These effects produce secondary symptoms of hyperventilation such as sinusitis, extramucous production, enlarged tonsils, snoring, sleep apnea, and other pathologies that worsen nasal breathing, creating an illusion that they cause mouth breathing. Hence, in order to stop mouth breathing, one needs to stop his or her hyperventilation and increase body oxygen levels. Mouth breathing treatment options are numerous. Depending on the current clinical picture and symptoms, the effective treatment for mouth breathing includes immediate respiratory techniques and long-term breathing exercises and lifestyle changes in order to retrain the automatic breathing pattern. What should we do? Breathe slower and less is the greatest health discovery ever. While this breathing technique and its breathing exercises may sound new to most people, they are in fact over 5,000 years old. You can find out the same and similar meditation and mindfulness breathing exercises in the ancient Sanskrit texts. Here's the advice for those who want to improve breathing: try to observe your breathing habits. Change mouth breathing during rest to nose breathing. Learn breathing exercises from Oxygen Advantage breathing technique. Use Myotape during the night to avoid mouth breathing, or if you suffer from mouth breathing during sleep, learn the medical technique how to tape the mouth at night for stopping oral breathing during night sleep. Note that for most people it is impossible to stop mouth breathing if they sleep on their back at night. Sleeping on your back increases chances of mouth breathing some 5 to 10 times. For this reason, if you sleep on your back, it is also important to apply the treatment. Myotape is a patented lip tape designed to bring your lips together gently and safely. It is the only tape that surrounds the mouth rather than covering the lips. This reminds the mouth to close, and it removes any anxiety you may have about mouth taping. Designed to support the practice of the Oxygen Advantage breathing exercises, Myotape can be used during the day, during physical exercise, and at night. Or you can start the breath training program with me. Until then, breathe through nose, slow and low through your diaphragm. If you like the video, click on the like button, and to never miss any new video, subscribe our YouTube channel. And if you didn't see our video about diaphragm, our main breathing muscle, I highly recommend watching it.